The bladder's job may at first seem easy, since the kidneys constantly produce urine. A receptacle is needed to keep it from flowing out. As simple as that. But there are some problems. For example, what happens when we stand on our heads? To keep urine from just flowing backwards, a layer of muscle surrounds the ureters. This lets them work against gravity. The bladder fills up, and more questions arise. How does the bladder know when it's full? And how does the urine get out? In theory, the bladder can hold about 1 liter of fluid. But even at 1/4 liter, nerves inside the bladder's inner lining detect when it expands and pass the information onto the autonomic nervous system. This, in turn, controls muscle fibers in the bladder's inner lining. Now, the urethral orifice opens and the bladder empties. Problem solved? Not quite, as we'd like to be able to control when and where that happens. There's another urethral opening that's controlled by the somatic nervous system. This lets us consciously stop the flow of urine. Children must first learn bladder control, including at night when their minds are elsewhere. Because so many nerves and muscles control the system, malfunctions can have different causes, such as urinary tract infections, which mainly occur when bacteria enter the urethra. This often affects women, as their urethras are much shorter. And the external urethral opening is part of the pelvic floor muscles, which are subject to severe strain during pregnancy or heavy lifting. Hormonal changes, such as during menopause, also weaken the muscles, which can contribute to urinary incontinence. But regular pelvic floor or Kegel exercise can help us improve bladder control.